Ready? My name is Jack, and I was recently injured and in an accident that actually occurred at work. I had a 250, somewhere in here, 250-pound Christmas tree that was an artificial tree fell on me, and 3 days after it happened, I was rushed to the hospital in emergency early in the morning because I had severe back pain. Initially, they thought it was a kidney stone being passed, and following being admitted into the hospital, they found out that I had a herniated disc, and that bulge, I guess, in the disc was pressing against the nerve and was causing the pain. The short version of this is that I was given morphine in the hospital, and then afterwards I was sent home with Oxycontin and prednisone, and it was pretty painful. And in fact, 4 days later, I had to be readmitted again because the pain was severe enough that the Oxycontin was, the dosage that I was given was not cutting through the pain. The doctor said that, the herniated disc was pressing on the nerve. Well, between the first day that I was admitted to the hospital and when I went back the second time, I started using the BEMER. And because at that point I would use anything that possibly could give me relief because I couldn't get away from the pain. Initially, for the first several days that that I used the BEMER, it seemed to actually intensify at times the pain. But what I found out was later I was told that that was most likely enhancing the blood supply around where the disc was herniated, and that was the reason for it. Well, the long story short again, about 3 weeks after the initial injury and going to the hospital, I was told I had to go to occupational health and safety because it was a work-related injury. When I went to that clinic, and the nurse practitioner asked me, she said, based on what I see on the MRI, she says, do you need another dosage of either the Norco or the Oxycontin? I says, well, I'm not taking any prescription medication. I haven't been taking it for about 2 weeks. And she was absolutely surprised. She didn't understand it because she was looking at the MRI, and according to her, I should be in some form of intense pain. The only residual effects at that point that I had was my thigh was still numb from, I guess I was told by what the nerve had gone through in the damage. But as I'm talking right now, approximately 2 weeks ago, that numbness has gone away, and I can honestly, with no reservations, tell you that I do believe that the BEMER had everything to do with making this recovery a lot faster. So that's my story, and I'm sticking to it.